Hello, and welcome to the StellaLife Innovator Series. I'm Liz Lundry, a hygienist of 40 years and the Clinical Education Manager for StellaLife. Today, we're going to be featuring Dr. Lorin Berland, and he is an internationally acclaimed cosmetic dentist and one of the most published authors on clinical dentistry. With well over 100 articles, the best-selling Lorin Library Smile Style Guide, and as well as instructional videos, Dr. Berland has made a lasting impact on dental education. He was the first fellow of the American Academy of Cosmetic Dentistry and included in the top 100 CE leaders for 19 consecutive years, and was even recognized by the AACD for outstanding contributions to the arts and science of cosmetic dentistry. He created the original dental spa concept and the multi-specialty group practice. His unique approach to dentistry has been featured in major national print and TV publications such as 2020, Time, Town and Country, Reader's Digest, and GQ. Dr. B began his career as a denture technician, which gave him special insight to the needs of patients with dentures and oral appliances. With this insight, he developed Dr. B Dental Solutions, a full line of products specifically designed to treat the common yet serious issues affecting the daily lives of people with oral appliances. So today, we're very happy to welcome Dr. Lorin Berland.
The current COVID crisis is certainly unprecedented. It has changed the way we live, changed the way we work. It certainly has affected dentistry. From now on, people are going to want what they want when they want it. And dentists are going to have to accommodate people's schedules if they're going to survive. But how can one dentist do that? One dentist can't. It takes a team to provide the service that people are going to require in the future. A group of dentists will benefit the patients and benefit the group of dentists, because now they'll be able to stay open 7 days a week, have early morning and early evening hours. They'll never close. People won't need vacations. People don't care if you need a vacation or you need a personal day or you need time off. They want to be seen when they want to be seen. A group of dentists in one practice has huge benefits, and not just for the patients, but for the dentists themselves. There's less hours per dentist, less overhead, and less headaches. And with all the new guidelines and all the new technology, it's the only way that a dentist can keep up to date and still be profitable. The doctors can focus on the procedures they like best. The patient sees the dentist who doing the things they like best, and they can be seen 7 days a week. It's a win-win proposition for dentists and patients. Dentistry is an essential and noble profession. Will always be needed. But let's face it, people are scared now. They're going to put off treatment. Maybe put off treatment until it's too late. And when that time comes, they'll probably opt for less expensive and less extensive procedures. They'll probably want the tooth removed. That's why people are so excited about StellaLife's Oral Recovery Kit. Oral gel and oral rinse helps people recover faster. And the faster they heal, the better they feel. And the better they feel, the better the dentist looks. Dentistry has made significant progress in bone grafting and implants. During these times, people may opt for removable appliances instead. I think that you'll be seeing a demand increase for flippers, partial dentures, dentures, as well as overdentures. These removable prosthetics, they could be the final restoration, or they could be considered long-term transitionals. It's really up to the patient and the dentist to make the decision. But these are scary times, and you're going to have to accommodate your patients. This is an example of the platinum rule versus the golden rule. The golden rule, you do unto your patients that you would do unto yourselves. The platinum rule is you do what's best for the patient. And in these times, I think removable prosthodontics will be chosen more often. Once we can take our masks off, I think cosmetic dentistry is going to be bigger than ever. You can thank social media for that. Instagram, Facebook. I mean, people may not be able to afford implants or a root canal and a crown, but they certainly can't afford walking around with a jacked up smile. I mean, you can't even get a job these days, let alone a date. Don't forget, dentures were the original cosmetic dentistry, and what's old is new again. I was a denture tech before I became a dentist, so denture patients have always been important to me. While so much has improved in home care for people with teeth, nothing has been improved for denture wearers in over 50 years. Big Pharma just keeps selling the same old stuff. And in fact, some of the stuff has actually gotten worse. Denture adhesives were forced to take out the zinc because it was causing all kinds of nerve damage to denture wearers. But when they didn't reformulate it to make it more retentive. So now, denture adhesives may be more safe, but they don't do what they're supposed to do. They don't hold dentures in. So I came up with Adhesident denture adhesive with a whole new copolymer that doesn't need zinc. And because we added moisturizing agents as well as aloe vera, vitamins A, D, and E, and a secret sauce, it moisturizes the mouth as well. And by moisturizing, you've got a much more comfortable and a much more retentive denture. And Adhesident denture adhesive works best with less, so it's economical too. I developed all these products listening to my patients, and a big complaint was, how do I clean my mouth and my denture? So I developed Cleanadent paste, Cleanadent toothpaste. It's the only moisturizing, ultra-mild toothpaste that's safe for dentures and safe for gums and safe for implants. It contains aloe vera, vitamins A, D, and E, coconut oil, and tea tree oil. And for on-the-go hygiene, we've got the Cleanadent wipes. They're individually packaged towelettes that are infused with the Cleanadent formula. And this way, denture wearers can discreetly step outside, go to the restroom, clean their dentures and clean their mouths, throw it out, and pop the denture back in. No rinsing is necessary. And don't you hate it when the patient comes in for impressions or records and you told them not to put any denture adhesive in and their mouth is full of the stuff? Well, now just give them an extra soft toothbrush, point to the sink, give them a tube of Cleanadent paste, and tell them, just get all that stuff off of your mouth and off of your denture and call me when it's all clean. And you'll see in about 5 minutes they'll call you and say, I'm all done, and hey, my mouth feels terrific. It's been estimated that denture wearers are twice as likely to contract pneumonia as non-denture wearers. And that number doubles if denture wearers sleep with their dentures. That's very relevant in this COVID era because pneumonia is the #1 killer of COVID patients. This is also extremely important to obstructive sleep apnea patients who wear appliance to increase their airways. Our liquid crystal soap cleanser is the only cleanser that kills candida, strep, staph, actinomyces, and E. coli. These pathogens are the major causes of thrush, pneumonia, and various digestive and respiratory disorders. Used in conjunction with our sonic cleaner, the liquid crystals are the absolute best and most effective way to clean dentures, partials, and overdentures. In fact, it's the only soap cleanser that's safe to use on the rings of overdentures. The liquid crystals are also great for retainers, night guards, sport guards, aligners, and especially airway devices. I mean, what's the point of opening up the airway to breathe in dirty, infected air? In conclusion, I think dentists will work together to provide more convenient hours and more services in one practice. They should focus on providing the best treatment, the best follow-up care, and the best take-home products, like StellaLife and Dr. B Dental Solutions. This is essential to long-term patient satisfaction, and that is essential to practice success. Doctors who understand this and implement this will not just survive, but they will thrive.
Thank you, Dr. Berland. As a longtime hygienist, I have found that this group of patients has not had many options to provide optimal oral health. So at StellaLife, we have natural solutions to help these patients as they experience xerostomia and the lesions that are often associated with the use of dentures and oral appliances. Visit us at the StellaLife.com website and contact us so together we can provide these patients with lasting relief and health. Please join us for our next installment of the StellaLife Innovator Series, and thank you so much. Please stay safe and stay well.